Well, welcome everyone. This is Healthcare for All Washington's second Wednesday speaker series. I'm Ronnie Shure. I volunteer as president of the board of directors for Healthcare for All. Tonight, we're going to share the work that our policy committee and our lobbyists have been doing to prepare for the 2026 legislative session. They've been meeting regularly with legislators, with state agency staff, and others during this interim period since the last legislative session, and we have a lot to present to you. So we ask that as each person comes on, rather than a long introduction, we ask you to go to our website, Healthcare for All Washington's website. It's HCFA-WA.org. And you can click on the icon that says About Us and scroll down to the line saying Meet the Team. And that way you can see the background of most of our members that are presenting tonight. Certainly, if you have questions, add it to the chat. Going to the website actually helps us share information. And tonight we will be sharing the information that we are putting on the screen, so you can go in there and see not just the members who are speaking, but you can see the goals and the mission and the strategies that we've been employing during the year. We welcome you to also go to the space that says on the website that says get involved. There's a place to volunteer, and there's also a place to donate. Donations really help us complete this work as we move along the pathway to universal health care. We will be watching the chat, so if you have questions, we are going to try to get to them at the end, but we have a lot of material to present tonight. You can go into the chat and find that donate button and either volunteer or check out our member profiles, the board profiles on Meet the Team, and join us as a volunteer. There's a number of opportunities. It's not just coming to a specific ongoing meeting. If you have time to make a specific help with one particular project, we'd love to have you join that. Also at the bottom of the screen, you'll see the closed caption button, and you can click on that and captions will appear. I'm participating in this Zoom meeting tonight from the lands of the Coast Salish people. Please take a minute now to acknowledge the peoples in the lands where you're joining us today. And there are people in different parts of our state. Thank you. We acknowledge all the ancestral homelands and traditional territories of the indigenous peoples who have been here since time immemorial. We walk the pathway to universal health care using the teachings of the leaders of indigenous people to remember the lessons of life, to preserve our land and our people. We thank the Coast Salish peoples of the land which touches the shared waters of all tribes and bands with the Duwamish, Muckleshoot, Puyallup, Suquamish, and Tulalip nations. And so we have several different sections tonight. We'll be talking about the budget, the good and the changes that need to be made. We'll be talking about our key priority for Healthcare for All Washington, the legislative actions that we are supporting, and some pre-filed legislations that we will be looking at. Then we'll add some time or set some time aside to talk about our allies, the work that we're doing with them, the work they're doing with us, and close out with comments about how to get involved and how to get two different ways that you can track what we're doing. So let me introduce uh, Denis Delwo and Sherry Weinberg. I remember your names. I'm just trying to find you on here to highlight you and bring you on. And it's not working. Ron, can you help me spotlight Denny and Sherry?
I think I'm spotlighted.
Well, I'm on because it's my computer, but
There we go. I see you now, Denny.
Okay.
And so take it away.
Well, thank you, Ronnie. And good evening. I'm Dennis Delwo from Spokane, and uh, I was very fortunate a number of years ago. I ran for and won the House Representative position in Olympia, and I spent 14 years there. Partially through that term, I was appointed by the Speaker of the House to be the chairman of the Healthcare Committee, the House Healthcare Committee. And we worked specifically, primarily on healthcare reform so that we would end up making healthcare more universal and less expensive. Uh, it was very exciting. We met with so many people, came up with so many what we thought were solutions to the problem. We worked very closely with the Republicans on our committee and received some good suggestions and adopted many of them. And we were successful. Got legislation passed, and surprisingly, we lost the majority uh, and became the minority in the following year. What the new majority party did immediately was they repealed the whole act that we had done. When I talked to the uh, representative from that party in our meeting, he said that he had talked with the insurance members, and they said that we don't need the law, that they will take care of it and will make it less expensive over the years. Well, of course, we've seen what's happened there. It's right. The cost of healthcare has risen tremendously. And so very disappointed in what happened there. But part of the reason I'm on the Healthcare for All Washington Board of Directors is because of that. I wanted to continue our effort in getting a healthcare system that will help everyone be universal and affordable. We're talking briefly about the budget because it's playing a very important part in this effort. This year we have a terrible budget deficit, and the state legislature is required every year, every time it comes up, they are to form a balanced budget for the next 4 years. Then you have a chance on the second year, which is what this year is, where you have a short session and you're able to amend the budget. And what we saw though was that we adjourned last spring after tackling a multi-billion-dollar budget deficit and passing what appeared to be a very balanced spending plan. Now, 9 months later, state lawmakers are back in Olympia for the next session, the short session, facing yet another budget shortfall. The state is once again in the hole, this time by more than $4 billion. I remember when I was in there, we didn't even have $1 billion budget. Spending Making new spending tough sell. Anybody asking for more money, a change in the budget in that respect is denied almost without looking at their proposal and putting significant cuts back on the table. The governor has proposed a solution, and we hope it will work. This is a short session, and we've got lots to do. Washington lawmakers typically must pass the operating budget, as I said before, for 4 years. During a tough economic time, though, they can adopt a plan that balances only for the current 2 years. Governor Ferguson has proposed using that option this year, which would narrow the immediate challenge by plugging a roughly 1.5 billion to 2 billion gap this session, and they have to finish by March. That could provide relief, especially if lawmakers could tap, as they did, the rainy day fund and make cuts in existing programs. But it would push much more of the problem into the next budget cycle. In February, they're going to be making another budget forecast. I'm not sure whether it'll be good or bad, but once we get it, we'll know. We need to continue to work protecting the healthcare programs. During the interim between the first budget and what we're in now, we worked very hard to see if the governor's new proposed budget would continue funding for the Universal Healthcare Commission, which we were very successful in getting adopted by the state legislature, and other funding moves that move us towards healthcare reform, universal coverage. We did well. We will continue to fight this because it's going to be very difficult in this coming session. We're going to need to fight to keep the programs that we have supported, that we've received funding for, still supported. Sherry Weinberg, who is a physician, is a doctor, retired, will now take over from me. Sherry?
Yes, well, I like to take the view from on high because you can get lost in the weeds if you look at the budget. And in a way, we need to get lost in the weeds, but I think it's important to simply understand that in a budget shortfall, we mostly need to try to protect what's already been allocated, and that and to support increased funding where we can manage it, to try to avoid draconian cuts. I've looked at some charts and things, but I think I'd really like to leave it at that. And one of the charts shows eventually taking money from a budget stabilization account, which I think is the rainy day fund. It's a fancier word for the rainy day fund, taking $1 billion from that and 123 million from some other funds and some revenue shifts and closing tax preferences that will lead to only needing to have 797 million in spending reductions. So I just want to leave you with the idea that it's going to be tough, and that it isn't that they're evil people in Olympia. It's just plain tough math and worse tough stuff being thrown at us nationally. So we can go on to Ronnie, the next group.
Yeah, so let's bring up Roger Gantz, a member of our policy committee and a member of the Healthcare Authority's Finance Technical Advisory Committee, and bring up Lonnie Johns Brown as I'm looking for you.
Yeah.
And
Yeah.
all right, Roger, and let's ask you to unmute and bring up Lonnie with him, and ask Lonnie if you could unmute and join Roger in this conversation.
Go ahead, Roger.
Okay. Well, good evening again. My name is Roger Gantz. I just want to reiterate what our colleagues previously talked about. For our legislative priorities for the 26 supplemental session, again, our focus has been on wanting to support key revenue opportunities that would avoid having to make draconian cuts in two areas. One, due to the fact of recently enacted legislation at the federal level, when referred to as the One Big Beautiful Bill, which is going to have impact on our state's Medicaid program and health exchange programs. And as mentioned before, we are also at the same time facing a $2.3 billion shortfall. So one of our main initiatives is to support the governor's work to date and what will be forthcoming from the legislature in their efforts to enhance revenue opportunities. The other strategy is also been is where opportunities present themselves is to be able to sustain the work that we've achieved to date and find strategies where we can seek to move healthcare reform forward, recognizing the fiscal constraints we have. So I guess I'd like to touch base with three areas and then have Lonnie follow up with that. One, we are pleased to see in the governor's supplemental budget request a continuation of funding for the Universal Health Care Commission. There's something like $514,000 for the biennium, and that is retained in the governor's proposed budget. Part of that is in the order of $250,000, which is funding that the Office of Insurance Commissioner has made available to help support the commission's work. So those aspects are retained in the governor's budget. Secondly, we were concerned and are pleased to see that the governor's budget continues a proviso that we played a key role in last session, and that proviso would direct the healthcare exchange to begin implementing what we call an auto enrollment system beginning in January, or at least begin the design of it in January of 2027. And the idea there being is that this auto enrollment system would help individuals who are losing their Medicaid coverage to be able to transition effectively into the exchange to continue health insurance coverage. We find to date that there's a big gap in people who lose Medicaid coverage and yet not successfully finding their way onto the Medicaid program. The auto enrollment system would greatly help with that. And then the third area.
And let's move to the next slide while you're talking about that, Roger. Thank you. Go.
Sure. Should I continue on or what?
Go.
Go. Okay. And then one other area that we have pleased to see in the governor's budget deals with additional money for the state's premium assistance program. This is a program of state dollars that help augment the work of the federal premium assistance for people who are in the exchange. The governor's budget includes $25 million additional dollars in the supplemental budget to help support the premium assistance program. Again, critical, ensuring that moderate income folks, low income folks are able to afford coverage in the exchange. Lonnie, you have some other comments you want to share?
Yes, thank you, Roger. Well, I'd like to stress that certainly that one of our major focuses will be to work with the legislature to find the dollars to help cover as many people who are going to be losing their Medicaid coverage. And there are some discussions about some options around that. One bill that Senator Robinson, the chair of the Senate Ways and Means Committee, is sponsoring has a hearing next week. It's 5949, and it would create a tax on healthcare benefit managers. I think we're all familiar with pharmacy benefit managers. They've been claiming that they don't have to pay our state B&O tax because their insurance. And of course, that would mean if they truly were, they'd be paying the premium tax, but they are not. And so this legislation will close that loophole. These are quite wealthy corporations that do benefit management. So that's an option that can be used to help try to fill some of these gaps that are coming our way. And they're working on some others. So this, the governor's budget was just heard this week. the House and Senate will now start developing their own, and our alerts will show all the updates on that and any new revenue pieces that we think would be most helpful to maintaining our safety net. Thank you.
Excellent. So thank you, Roger. We're going to bring John Sobek up and make you disappear and leave Lonnie and John to move to the next topic. As we
Great, you
move
want
the
to jump in, Lonnie,
slides
and I'll
forward.
add color commentary?
The next slide, please.
You're going to lead, John.
You want me to jump in? I think the main bill here that we're supporting is the Senate Bill 5387 and House Bill 1675 concerning the corporate practice of healthcare. And, you know, when you think about what it takes to run a medical practice as a person that's been both in private practice and a large group practice, this really gets down to the details of, you know, who should be making the decision about running a practice, down to, you know, billing and how we go after bills with patients, staffing levels, clinical guidelines, hiring and firing of clinical staff, setting policies for prices, rates, and collaboration with hospital partners. So really anything that has a clinical decision making to it, the legislation really wants to leave that in the hands of people who would be majority shareholders in the practice, which would be healthcare providers and not corporate owners. Do you want to jump into PEB and SEB budget proviso, Lonnie?
No.
No.
I would talk about bills because they've got hearings coming up.
Okay, great. The other bill that we're tracking, the Senate Bill 5949 that Lonnie already mentioned, the taxes on pharmacy benefit managers, which would be a pretty good income source. And then the third kind of major one is protecting access to discounted medications. You know, as we start responding to many things that happened in the 340, or excuse me, the big, bad, beautiful bill, a number of the legislative issues are trying to respond to that. I mean, there are issues around, especially some of our federally qualified health clinics that purchase, you know, high cost drugs at a markedly discounted rate and then charge insurance companies the, you know, higher rate and use that margin to help support their practices. There's also, you know, worry that the companies that are supplying these drugs at a lower discount will go after some of those discounted programs and decrease, you know, the ability to buy those. So I think those are important programs to make sure that the drugs that are expensive are accessible, and B, that the entities that buy those drugs can continue to buy them at a discount. Kind of lastly, just again, response to things going on in the national sphere, preserving access to preventative care at a zero out-of-pocket pay. And then if people are familiar with medical loss ratio, a lot of medical loss ratios that are thrown around is 85%, that 85% of dollars, you know, funding insurance companies have to be spent on healthcare and 15% on administrative issues. There's a bill, Senate Bill 5953 and House Bill 2283, that is trying to establish a medical loss ratio of 90%. So 90% of the dollars going directly to healthcare. Next on the last slide, just a number of things that we're tracking. They're kind of healthcare adjacent, the pre-filed bills. We're hoping to get more information, and they're often, you know, put forth by our healthcare champions that are helping us with other issues in universal healthcare. So a lot of things that are on the docket there. Easy to, you know, go to the Washington legislative site and put in the House bill number or the Senate bill number to get more information on those pre-filed initiatives, pre-filed legislation.
I will just add a couple of things on the two bills that John talked about that are trying to keep as much of our safety net in place. I think the one on preventative care, folks may have heard a lot about it because it's governor requesting, Commissioner Cooter from OIC request legislation, but it really is to set a state framework that would say, these are the preventative services that you health carriers need to continue to cover based on what the advisory committee at the US level for preventative medicine said in June of 2025. And to set that benchmark and to keep that, to prevent any erosion of preventative services on the behalf of healthcare carriers. The other piece of that, of course, is immunizations, a big one, and I think we all know kind of what's going on back east on that topic. But this also provides some framework for the Department of Health to continue to weigh in and use best available scientific information for state immunization policy. And then on the protecting access to discounted medications, the 340B program, that is really about making sure that the federal government created this program as a way of helping community clinics and our hospitals have access to dollars to being able to purchase these the drugs on the 340B program at a discounted rate. And then the whole purpose was to allow them to take that savings and take care of unreimbursed charity care and all the other things that they don't get enough money for. And given what's happening in terms of federal erosion for support in a lot of other areas, this bill would prevent the insurance, the pharmaceutical folks from saying, we're gonna pick and choose who gets to purchase this 340B program. And obviously we need to make sure that every tool available to keep our clinics and hospitals in place is there. And both of these bills on the preventative medicine and the discounted drugs all have hearings starting tomorrow and through next week.
Yeah, and I mentioned the loss to especially the federally qualified health clinics in the state of Washington. It's a huge part of their operating budget. The numbers I've heard, it could be as much as $100 million of operating budget for them. So really important that they keep that benefit. Okay, next slide. There was a question, and I might not be able to answer it as good as some others with a longer history. We are a member of Healthcare is a Human Right Coalition, Healthcare for All Washington, as are a number of people on this call, people from whole Washington, Washington, Northwest Health Law Advocates. And in January, the Healthcare is a Human Right did ratify its 2026 kind of policy priorities, and it really is, just a matter of making sure that there's, access to healthcare, and that the way we support that is anything in the healthcare is a human right priorities, as long as it supports, the things that we are supporting in legislative initiatives, is, we're all on the same page. So we may, different coalition partners may come at things through different pathways, but ultimately we're all here to kind of succeed in, kind of getting towards a one single payer system, universal healthcare system. Chris, anything to add to the Healthcare Allies partnerships?
Yeah, I wanted to talk a little bit about some of our other partners, Physicians for a National Health Program, One Payer States, and Puget Sound Advocates for Retirement Action. The PNHP recently published a report showing how returning Medicaid programs to state agency management, as Connecticut did in 2012, and also Oklahoma and North Carolina have done, could save states billions of dollars. This is money that would otherwise go to industry profits and rather useless overhead. So we have joined the campaign to eliminate private insurance carriers, otherwise known as managed care organizations or MCOs, from the state's Medicaid program. which is also known as Apple Health. These MCOs are risk-bearing entities. They manage the Medicaid system for the state. And it used to be that the state managed its own system, and what this program is designed to do is to try to take that back and have the state remanagement in order to save a lot of money. So key legislators have indicated that there will be no time to discuss a bill this session related to this matter. But Senator Cleveland did let us know that she is very interested in doing a work session on the topic after the session concludes. And so we expect to participate in that, and with the hope of generating support for a bill for next year. One Payer States is another one of our national partners, and they're continuing to lobby for passage of the Medicare for All bill, as well as the state-based Universal Health Care Act in Congress. The state-based Universal Health Care Act, or otherwise known as SABUCA, was reintroduced for the 5th time jointly last July by Representative Ro Khanna of California and Senator Ed Markey of Massachusetts. HR 4406 and S 2286. The National Medicare for All Act was also reintroduced last spring as HR 3069 and S 1506. Healthcare for All is still in full support of these bills, but unfortunately neither has much chance of passing anytime soon. And then the third group I wanted to mention was the Puget Sound Advocates for Retirement Action, PSARA, that's PSARA.org. They're again leading a campaign to pass Senate Joint Memorial 8002, which is a request from our legislature for Congress to level the playing field between traditional Medicare and Medicare Advantage plans. This joint memorial made it through both Senate and House Healthcare committees last year, so there is a good chance it will pass during this session. PSARA is also again supporting SB 5395, which would make improvements to transparency and accountability in the prior authorization determination process. And they're also supporting a new bill, HB 2100, which would extend a Medicare tax on high-earning individuals to employers to support a Will Washington fund. This would be a new fund that would help support healthcare and education, housing, and a number of other essential programs for low-income people. So that concludes my piece. Ronnie?
Hey, Chris, before you go on, could you maybe just give a couple sentences on, in the state there's Centene, Molina, United, and Amerigroup that are for-profit companies doing Medicare managed MCO, Medicaid MCO, but there is a not-for-profit Community Health Plan of Washington. And can you maybe just speak, how that would be protected under this, and they do support the federal qualified health clinics. That, it's not like all companies that do Medicaid management right now would be excluded. We'd want to keep Community Health Plan of Washington in.
Well, Connecticut used their community health plan, and they converted to what's called an ASO, an administrative service organization. So they weren't bearing any risk, and they weren't making decisions about who gets covered and who doesn't. So they could convert to that kind of an arrangement for the community health plan if they wanted to do that. They would also have to hire probably some additional ASOs to help run the program in lieu of the managed care organizations. But it would still save a tremendous amount of money in the process, which is what we need to be doing.
Great, thanks.
Thank you. So let's bring up Ron Lovell and Denny to talk about a couple of some key issues and how to get involved. And move to the next slide, Ron.
Okay. Well, we've heard a lot about a number of different laws and bills that are coming into play. And the question is, how do we advocate for those? I'm going to show you a few screens about how we make that work with the Take Action Network. The Take Action Network connects you with your legislator about a specific bill so you can voice your opinion at a time the bill is being considered. It works like magic, actually. Here's some examples. How you get to be a member of the Take Action Network is go to our website, healthcareforallwashington.org and TAN, and you'll find a link to please click here. This will give you more information about the Take Action Network and how we use it. When you click on the link, you'll go to a link where you can fill out this form, the Take Action Network. Pretty simple stuff. Your name, last name, your email address. You make up your own password, make sure you remember it so you can confirm it. And what that gives you is an alert every morning about a bill that you might have interest in. Click on the I'm not a robot and then sign me up. And there you go. You are part of the Take Action Network. What does that email look like? This is an actual bill under consideration now that is being heard tomorrow morning at 7 o'clock. We've already prepared the bill, what you want to do. We're supporting that bill. And all you need to do then is click here to sign in. There are other options where you can write a message. You can submit written testimony about a specific bill. But the easiest way is to do it this way. Click here to sign in pro. When you do that, you're taken to another screen where you're actually signing into the legislature. You sign in choosing here, pro or con, your first name, last name, your email, fill all these in. Click again, the computer is asking you to affirm your humanity and then submit registration. To make your voice heard about a specific bill will take you about the same amount of time as it just did for me to go through those screens. You don't have to do the research because our policy team has already done that. And now Denny's going to talk more about how we make the laws and where this fits in. Those of you who are in attendance tonight, we have your email. You'll get a digital email tomorrow that will walk you through the steps that I just showed you for your ability to recognize as you go through the process. Benny?
You're on. It's kind of a neat process that many people don't understand the beginning of a piece of legislation. As a legislator and then also as a member of the Code Revisers Committee, I follow it through. They have a drop box where you drop a piece of legislation that you're wanting into a box right there at the Code Reviser's office. You can't just drop an idea in there. You need to get a legislator House representatives or a senator to sign on, because he's the one or she's the one that can request the code revisers to put together a bill. So you have an idea. You find your legislator that's going to sign on for you, and you drop it in the box. And it might be just a simple idea, raising the drinking age to 40. Okay. They then, meaning the code revisor's office, have wonderful staff that take that one sentence or a list and turn it into an amendment. Because there's so many things that have to change. There might be gender, there might be numbers, there might be hundreds of spots in the legislation that need to be changed, not just one little section, but a whole bunch of them. They make all those changes, then they submit it to the legislation, to the legislator. It goes into the House or the houses, depends on if you have two bills, in, let's say, the House of Representatives, and then it is circulated around on the floor of the House. And I would have a chance, anybody that is a legislator would have a chance to sign on. And many of us do that because we see something that we like, we read it, we determine that it is doing what we would support, we then sign on. The bill is then printed and it goes to the Speaker of the House in his office, and they make a decision as to what committee would be the best one to receive this. And it might fit into one and not another. It goes to that committee and it can sit there for a long time. The chairman of that committee is the one that has to decide whether or not it's going to get a hearing, when the hearing would be, and what kind of support it will receive. They won't take a bill, or might not put a priority on a bill that isn't something that is important, is more important than some other bills. But it goes through the committee, and then that's the time that legislators that support this legislation go out and try to get people like you and me to agree with it, to file our support for it, to give testimony for it. There's a number of ways you can give testimony at the committee. And one is, as Ron was talking about, you can get online and you can enter your statement, you're in favor of it, you're opposed to it, what your thoughts are on it. You can appear in the committee and get in line for testimony, be just a short bit of testimony, or you can leave a statement, a written statement. It has to go through a process of getting enough votes that will be able to get it on executive. It has a hearing and then it goes on executive. It's voted, usually doesn't come up unless it has enough votes. The sponsor of the bill usually finds enough votes or it's not going to get passed. It goes on committee, gets passed, and then it goes in the rules committee. The rules committee, which I've been on, it's like pieces of gold. You have someone's life in your hands where you get to say, I want this bill to come out on the floor and be voted on by the whole House of Representatives or the Senate. Not all bills get heard like that. You need to have some lobbying, if you like, to get that bill out of rules. If you made it that far, it usually has a chance, but you got to get it out of the rules and onto the floor of the House, and then it goes over to the Senate. With one last thing I wanted to touch on, and this is probably the way you can do the most. As a legislator, you welcome comments from people. What I enjoyed the most is when organizations and groups like nurses, like doctors, like dentists, like homeowners associations come into my office. They usually make an appointment and they apologize because they think they're imposing, but they're not. We're getting a chance to see the people that support this, to be able to ask questions of them, and you have a better chance of supporting their legislation if that person or those people come into your office and talk to you about it and say, this is something very important for Spokane or very important for the state of Washington. Take advantage of that. If you can't come to Olympia, then you've got other methods, which they have ways in which you can do, which like Ron was talking about, or you can send your own letters, or your association can send lists of names that support it, or individuals. As a legislator, the most effective one is to have someone from your district, my district here in Spokane, to come in to see me and say, hey, this is something very important to Spokane or to the state. We really want you to support that. That has a real impact. If I get 100 notes from the Teachers Association that just say, I support 8192, I support you. You measure that more by weight. If you get 10 pounds of it, then it carries a lot of weight. But the most important one is to personally contact by phone or in person the legislator and to show your support and have them support it, your legislator. If you get done with that, you can contact others. That's my advice.
Thanks, Denny. So let's take a step back where there was one slide that we didn't share. And if you could unshare, let me have John go through our legislative priorities one more time.
Yeah, great. We talked about the corporate practice of medicine. Lonnie went into pretty good detail about taxes on pharmacy benefit managers, which is really kind of a loophole they've taken advantage of over the years. We did mention the protecting access to discounted medications, the 340B pricing program. There's probably two areas where that's important, changes with the big, bad, beautiful bill and funding, and then what the drug companies might be doing to limit access to the programs. Preserving access to preventative care. You can look up those bills. Again, trying to just set into law what's covered under kind of a zero out-of-pocket fee. This is probably the most interesting is with the vaccines that are changing is that the CDC is now saying less vaccines are needed as part of the pediatric program, but the Washington State Alliance with other states are saying we're going to maintain some of those main vaccines and then support that they are covered for zero out of pocket. And then again, increasing the medical loss ratio to at least 90%, where right now the standard is closer to 85%. So kind of decreasing the amount of dollars that are going into insurance company profit, buckets.
Thank you. And I seem to have lost total control here. Ron, can you highlight and bring Peter Lucas up for a closing request together?
While he's doing that, Ronnie, I want people to focus on the chat. There's a number of really good comments in the chat about upcoming meetings. PNHP Washington is having a meeting next week about deprivatization of Medicaid, and via Zoom, PNP Washington is also having Dr. Kimball from Hawaii, talk about the plans to deprivate. Oh, that's probably the same meeting. So yeah, so that'd be an interesting meeting next week, the 21st, for people to attend on the issue we brought up.
So we do ask you to go to our website and if you are able, make a donation. If you are interested in helping us do this job better, go to the location for getting involved and volunteer. We'd love to use your expertise, and if you are able to make a donation, certainly recurring donations, even small amounts, can really make a difference in helping us get this job done. So, thank you all for joining us tonight. Sorry about the misplacement of that one slide, but appreciate your taking your time to join us. I'd like to thank the members of the policy committee who shared our work tonight. There also are other members behind the scenes. Thank you to Emil Chang, Sherry McAvoy, Marcia Stedman, and Hal Stockbridge, who participate in regular meetings and in the work of individual one-on-one meetings. Also, the Communications Committee has made a valuable contribution to alert each of us to each of you to how we are doing this work and to getting you here tonight, to alerting you to events like this. So thank you to Marcia Stedman and Sydney Jones and Connie Rock, Conlin Hong, Howard Rosenfeld, Brianna Malak, Mohit Nair, and D.W. Clark, who are behind the scenes, and some of the policy committee people have been participating in that. So watch for details about our next upcoming meeting. And John, are there other things in the chat that you've identified to share?
Yeah, I answered a number of questions throughout the chat. I think we're mostly caught up, but I did want to make one plea. I was going to make it after Ron made the conversation about TAN. If there are especially clinical experts on the call who might be willing to do in-person or Zoom testimony above and beyond what's on TAN, I mean, reach out to me or other members, board members, and we can help coordinate that as Lonnie, our lobbyist, starts to put together issues where we may want to contribute. The more we can have people kind of speak to those issues, especially, the clinicians that affects the most. I mean, just we can help coordinate what you say. But I think any and all efforts to kind of support the legislation we're putting through is appreciated.
Peter, I couldn't find you to bring you up for the the little conversation about donating. Is there something you can add before we leave?
You can't find me? Here I am. Okay. Well, yeah, I want my 60 seconds of fame if I can have it. I do this at all the meetings. So I'm the Peter Lucas. I'm a practicing physician and the treasurer and of this organization. And I want to thank you all for being here tonight, and thank the board members who presented and the volunteers. As you know, this organization is very involved in all the legislation lobbying that you heard about earlier. We know many of the legislators personally, have longstanding relationships with them, the board, and of course our wonderful lobbyist Lonnie, and who was on the call tonight. And even though we sort of operate on a shoestring, we could still certainly use some funds to pay for our lobbyists and for our communications specialist, plus also for these activities, these webinars and outreach activities. So please donate tonight. We especially appreciate recurring donations that provide support throughout the year. Those are monthly. There are links in the chat, and also, as others have said, please consider volunteering for us. There are plenty of opportunities. We could use your passion and your expertise. So thank you all for coming.
I would just like to add that even shoestrings cost money.
Yeah, exactly.
So, Chris, you're still here. Can I ask you to join me in answering this one question about and maybe you might help us out, Roger, in this one question about Medicaid deprivatization. So one of the comments or questions is, can we do this without any legislation? Can we change remove the middleman from Medicaid, our current state Medicaid program, without legislation? And I think part of that is there is old legislation on the books. What is the current approach to the most likely approach to making that happen?
Connecticut, the governor just ordered it. He got so frustrated with the private insurance companies that he, with them not cooperating with anything that he needed, that he just ordered it. So you need permission to start the MCO program, but I don't think you need permission to end it.
I think there is a bill in the legislature right now that maybe Bob Hasagawa introduced, but doesn't have any co-sponsors. That somewhere I have the bill number, so it lays it out a little bit, but it's obviously not going anywhere this year.
And certainly
Bill
our
numbers
approach is to
5955.
be working with the chairs of the healthcare committees for a work session to educate legislators about that. Roger, can you give us a bottom line on what it'll take to do it?
Sure. I think the question has two parts to it. One is there needed to have federal legislation to afford a state to be able to change from managed care to fee for service or fee for service to managed care? And my point being is that there's existing legislation out there such that there is not a need for federal legislation. There would be a need to what they call a state plan amendment to the federal government explaining what is going to be done, and that state plan would need approval, but it doesn't require federal legislation. I think the other question is, does it require legislation at the state level? This is my own personal opinion. I think the answer to that is yes. That was the case in Connecticut. The governor was not happy with his relationship with the managed care organizations, but there was enabling legislation that created what we refer to as the Medicaid administrative service model in that state. And my own personal judgment, necessary legislation would need to occur in our own state. This does represent, I would say, a major shift for the Medicaid program. I mean, today there's approximately 80% of the people in Medicaid or in managed care delivery systems. So to move a different direction to a fee-for-service or an ASO model would require support of the legislature, in my opinion, and of course, obviously, the governor.
So thanks. So it's appreciate everybody's participation tonight. Thank you again to all of our policy committee people that have been working on it, and thanks to all of you for it wouldn't be happening without the work of everyone in the state. So thank you for joining us tonight. Thank you for the work that you're doing with legislators and with agency staff, and we look forward to, please join us at our next second Wednesday speaker series in February. So thank you all very much.
Thank you, Ronnie.
Good night.